I'm not a doctor, and what I give to you is just information. You have to check it out with your doctor, and you have to seek your doctor's counsel if you want to do anything. Yeah, so I'm not a doctor. I will not give consultation. Okay, tonight I'll be talking about prostate. The prostate is a very important part of our organ in the body. As you read here, the prostate is a gland found only in males. Yeah, it's just beneath the bladder, and this is where, you know, the sperm is produced, and it's very important part of our male organ. As we age, the prostate become bigger and bigger. Normally when you are young, it is like the size of a walnut, very small. Then when you are about 35 to 50, it may be like a golf ball. Or age 50 to 70 years old, it may be like the size of an orange. And age 70 and above, it might be the size of a tennis ball. Why is it important to understand the prostate, especially for men? I understand there are some ladies here, you know. So maybe you're attending just for information's sake, or you want to advise your friends. Yeah, very good. I will provide this video for you after the meeting. So if you are in my chat, I will give you the video. As we grow older, our prostate enlarge, and it affects people who are above 50, sometimes even at the age of 40, we are affected because of our lifestyle, our diet. It may affect us, but it's all part of aging. As we grow older, you know that the prostate will grow bigger. These are some of the symptoms that you have prostate problem: frequent urination, you feel very urgent to go to the toilet, and a feeling of not emptying all your urine. Even after you go to the toilet, you feel like it is still not empty. Or sometimes it may be very difficult to urinate. It takes a while for you to urinate. You have to push, and the stream may be weak, and the flow may start, and for some people they may feel a burning or stinging urination while urinating, or you may feel uncomfortable between your legs, and it may be caused by a urinary tract infection. When I took Eddie and Ronnie came to UK, I took them for a tour in Scotland and many parts of UK. And Ronnie, who was with us, go to the toilet a lot, and shockingly, too many times. Even before we start the journey, he has to go toilet, and then when we stop somewhere, we have to go to the toilet. I think he has got a prostate problem, and this is common among men. But why do we need to talk about this? Because there's good reasons. One of the causes of prostate can also cause you to have erectile dysfunction. For men, that means you cannot have an erection. These are some of the symptoms that you know you have a prostate problem. And it's important to check if you suspect you have a prostate problem, because it will affect your health. You do a test. The test is called a PSA test, where you take your blood and then you will test to know why your prostate is enlarged or how high is the PSA, and with that you will know whether you have cancer or not. So the PSA test is to give you the information on how much is your score. It can be from 0 to 2.5, which is normal. 2.6 to 4 is a bit high, but it's very safe still. But 4 to 10, suspicion there's something wrong. Or 10 and above, it could be dangerous. Yeah. So once you have high PSA level, then you need to find out whether you have prostate cancer. And the only way to find out very clearly is not through the PSA test. It is actually through an MIR scan. An MIR scan is actually a scan where they feed, you know, radioactive into your body. Actually, they put sugar in your body because sugar attracts cancer, and all those cancer cells will respond to the sugar in the radioactive that is pumped into your bloodstream. So with that, they will be able to detect whether there is cancer or not. So once that happens, The doctor will normally ask you to go for a biopsy. So that means we'll be cutting out the tissue from your prostate to see whether there is cancer or not. Once that is confirmed, then you'll find out that what different stage you are in actually in the cancer. But for normally people who don't have cancer, this is some of the treatment that is used to reduce the prostate. Rhythm therapy, this is use steam to blast on the prostate tissue. Aquablation therapy, that is to use water jet onto the prostate. Then prostate artery embolization, that is to block the blood flow and then to shrink the prostate through the blocking the blood flow into the prostate. This is some of what is being carried out, and there are traditional methods of doing as well, that is like using surgery to take it away, to reduce the size. So these are some of the procedures you make. There are ways actually to reduce your prostate through food as well as exercise. So I want to give you a video on it to help you see some of the things that you can do. These are some of the food that is very good for people who have prostate problem. Number one is tomato, orange, Brazilian seed or Brazilian nut, then avocado. These are very good for prostate problem because it contains lycopene. Lycopene is a red carotenoid pigment that is found in this fruit or vegetable like grapefruit, tomatoes, carrots. You can have a lot of lycopene in these fruits and vegetables. So these are some of the fruits that can help you. And for some people, they are suggested to take a supplement. We call it some palmito, that comes from a kind of palm, so that seed is supposed to be able to help to reduce the size of the prostate, which is taken by most people who have it. Then lycopene capsule, if some of you don't eat vegetable very much, then you should take this capsule to help you reduce the prostate. And there are also exercises that can help to reduce the prostate as well, and we want to go through the video for this.
So this is pelvic region, and the floor of this part is known as pelvic floor. So the exercises will be of the problems with prostate. In today's video, I'll be sharing with you 5 very simple exercises, plus I'll be sharing with you name of Ayurvedic herbs as well as name of some vitamins and minerals that can be helpful. Hi, my name is Dr. Vivek and welcome to my YouTube channel. Whatever I'm going to share with you, these are the things that I have applied in my practice. I have seen good results with people who do these things after being sure that yes, these things work. Now I'm sharing with you in today's video. So do give it a try. I'm very much hopeful that many of you are going to get good results. So talking about the exercises. Exercises are going to be of pelvic floor. Pelvis, this part of our body is pelvis. This is buttocks region. Buttocks region is made up of 2 bones. Those bones are the pelvic bones, and inside the bones we have lots and lots of organs that are protected by these bones. So this is pelvic region, and the floor of this part is known as pelvic floor. So the exercises will be targeting pelvic floor because prostate gland is in the pelvic floor area. So the first exercise is called Kegel exercises. In these exercises, what we have to do, it's very simple. Can be done when you are sitting or while you are standing. If you're in office or at home or even in a transport, you can do this exercise anywhere. How to do this? Very simple. You have to just contract your hip muscle. That's your gluteus muscles. You have to contract them very hard. You can try right now. Just contract these muscles very hard, as much as you can, and you'll feel that you are contracting your anus also. the anal canal. You have to contract that also. Focus in the area that's between the anus and the scrotum. This is the area where prostate is. So just squeeze all of the muscles, squeeze the anal canal and just hold it for about 5 to 10 seconds and then release. This simple exercise is Kegel exercise. You have to do this exercise 10 times. This will be one set and you have to perform 3 sets. So you did 10 times, then have a gap and then again perform 10 times and then perform again 10 times. In this way, 3 sets of 10, 10, 10 you have to do, and you can do it 3 to 8 times throughout the day as you are comfortable. Just do these exercises. Minimum is 3, maximum is 8. Do these exercises every single day. This exercise particularly is totally targeted on your prostate. You are going to feel some tingling sensations, some pleasant but kind of uncomfortable feeling. You will understand this when you will be doing this. If it's your first time, don't hold it for long. Hold it for 3 to 5 seconds, not more, and then just release it. Don't do more than 3 times in a day. Gradually increase the time of holding also and the frequency of doing throughout the day. So first exercise is this one. Second is pelvic tilt. As I told you that it's all about pelvis. Prostate is in the pelvis. So when you will be tilting it, it will be very helpful for your prostate also. How to do it? Very simple. You have to just lie down. After lying down, put them in the position so that you are comfortable. Sit in this position and now perform this exercise. Just put the hand and see the gap between your hips and your spine. There will be a gap. This is because your pelvis is not tilted. Now to tilt, what you have to do is just release all the air out and just tuck your tummy in as much as in you can. Just do this and you will see that now your pelvis has been tilted. Now just see the gap. You will see that now there is no gap. Why? Because your pelvic tilt has happened. Hold it for about 10 to 20 seconds as you are comfortable. Then just breathe in. Do this 3 to 5 times as per your comfort. So this is the first variation of this exercise. Now we'll move towards the second variation of pelvic tilt. For this, again, the position is going to be the same. Hands are on the side. Now what you have to do is just hold one leg and push it towards yourself. The toe is going to point inwards and don't overdo it. If you will overdo it, your pelvis is going to be in the air. No, don't do this. This gap should be maintained and there should not be pain in your back. Just feel a good stretch. Do on one side, hold for about 5 seconds, then leave and then perform the same on other side. Be sure that there is no gap. Your pelvis is tilted. Same, breathe out, then stretch it towards yourself, then breathe in and just relax. And this way you will be doing on both the legs. This is the second variation. Now the third variation. For this, again, position is same. Again, you will be breathing out all of the air and tucking your tummy in. After this, check there is no gap. Yes, your pelvis has been tilted. Now you'll put one leg on another leg and now you have to hold it from inside, and while holding, put your elbow on the knee and try to push it. This will create more resistance. This will create more stretch. So hold like this and push it towards yourself, but don't overdo it. Your toes, both the toes are pointing towards yourself. It's inwards and then push it towards yourself. Hold for 3 to 5 seconds, release. Do the same on another side. You can do 3 to 5 repetitions on each leg. This is third variation. So this was the second exercise, that's pelvic tilt. Now third exercise, it's hip thrust. For this, just lie down on the floor. Do the same thing as we have done in the previous exercise. Tuck your tummy in and then raise your hips upwards. And while raising your hip upwards, squeeze your hip muscles as we have done in the first exercise. So it's combination of both the exercises. Now you have to just squeeze your hips, squeeze your anus and just hold for 1 or 2 seconds. Then come down. Again, up and down. This you have to do 10 times. You have to do 3 sets of 10, 10, 10. This is going to be very helpful even if you are in back pain. For back pain, it's good exercise. For prostate, it's very good exercise. So hip thrust, this is the third exercise. Very, very effective. Now let's move towards the fourth exercise. That's butterflies. Very simple. As you can see in the video, this is done this way. Just you are sitting on the floor, legs joined and inwards, and now you're moving your legs as butterfly wings. But if it's hard for you to perform this exercise, no worries. You can sit on the floor and you can just push your legs outwards, as you can see in the video, and hold over here and then perform the exercises. If you have back pain or if it's hard for you to sit on the floor, then use pillows. Put one pillow or two pillow, or there are yoga bricks also available. So whatever is easily available, use that. Sit on a height and don't sit on the pillow. Sit on the edge of the pillow so that your body is leaning in the front. And this way you have to sit. Now hold the legs and perform the butterfly. If it's hard for you over here, then you can just put your legs till forward and then perform exercise. Don't do this exercise with ego. No, don't do it. You can put as many pillows you want. Don't be ashamed of it that you need lots of pillows or lots of bricks. It's all about practice. If you'll do it for 6 months, you are going to be pro in this exercise. No one has super flexibility for all of their life. The person who have super flexibility is the person who regularly practices stretches. So practice makes a man perfect. This is true, and this is true for you also. So do it as you are comfortable and you feel you're not going to be injured. In this way, you are going to perform this exercise, that's butterflies. Now let's move towards the fifth, the last one. And this is the most common one, but people don't know that this is very effective for prostate also. And that's walking. If you can brisk walk, very good, but you have to walk every single day. Walking is going to give good boost to your hormones, especially the testosterone. That's going to help you with prostate also. It's going to improve the circulation in your leg in the lower part. This is also going to help you with prostate. Walking itself is very helpful for prostate. So walking is the exercise, but make sure it's good walk. I have seen many people after their dinner or lunch, they just walk so slowly and easily like they're walking in a garden, and they walk for about 300 meters maximum and they think that they have done enough walk. No, you're not going to get any of the benefits of this. Walk at least for 2 kilometers. If you are able to walk, this is going to be helpful. If you are in pain at 2 kilometers, you can walk less, but try your best, give your best. This is going to help you. Lazy walks are for lazy people, and lazy people are the people who are constantly ill. So don't be lazy. Be strong, be active. You are going to get good results. So these are 5 simple exercises that can be helpful. Now let's move towards name of vitamin or mineral. The best vitamin is vitamin B3. That's helpful. And the best mineral is zinc. Taking zinc and vitamin D3 can be helpful in having a healthy prostate. If we talk about Ayurvedic herbs, Varuna, awesome herb. I have seen tremendous results of Varuna. These are simple recommendations that can be helpful for you. These things are available on the internet. You can search, you can Google them, try to find them and use them. So these are my simple tips. Try them for a month. Come back to this video, write your feedback. It will be interesting for me and for other people also to read your feedback, your experience. I'm sure that this video is going to be helpful for many people. So give it a try and make sure to pass this information to the person who is in need. Simple recommendations, simple exercises, herbs, vitamins, but they can be very helpful. I hope today's video will be helpful for many of you. See you in next video with a big smile. Up to that time, smile more.
I hope this video can give you some information to help you.
An enlarged prostate afflicts millions of men around the world. These symptoms that go along with an enlarged prostate, also known as BPH or benign prostatic hyperplasia, An enlarged prostate afflicts millions of men around the world. These symptoms that go along with an enlarged prostate, also known as BPH or benign prostatic hyperplasia, are very obvious to the men suffering from this. There's tons of research that's been done about enlarged prostate, and almost always it comes down to hormones. And there is absolutely a hormone involved in 80% of your prostate problem, but it's not the hormone that you may have read about or heard about. I'm Dr. Ken Berry, a family physician with 20 years of clinical experience, and that's what this video is about. If you have an older male friend or family member, I promise you it won't hurt their feelings a bit if you share this video with them. And you're also welcome to share it on your Facebook page or in your groups, on Twitter, Instagram, or wherever you think it's going to help an older male friend or relative get relief from their enlarged prostate symptoms. I suspect this video is going to be quite controversial with urologists and other healthcare providers who specialize in the prostate, because it's going to talk about something that, although they know about, they've never thought about it like this. And so I've included several research studies in the show notes below to back up what I'm saying in this video. Hormones are definitely at play, and one hormone in particular is predominantly to blame for your enlarged prostate. So let's go through the 7 easy steps of how to reverse your enlarged prostate, and then I'm going to talk a little bit more about the science. And then at the end of this video, I'm going to talk about prescription medications, your other hormones that are also involved a little bit, and then some supplements that some people find help greatly. Other people don't really find that they help that much. Now, the hormone that's involved in 80% of your enlarged prostate problem is not testosterone, it's not DHT, it's not estrogen, it's insulin, okay? Your prostate is a gland, and it responds to growth signals from hormones. Insulin is one of the preeminent growth hormones in our body. When you're eating an improper diet, you're actually causing yourself to have hyperinsulinemia in your blood all day, every day, or at least right after your meal for a few hours if you're eating the wrong foods. This insulin, when it's in high amounts in your blood, can actually bind to a receptor for IGF-1, which is intimately involved in the cells of your prostate growing and multiplying. And so what you wind up with after years and years of hyperinsulinemia is that you've got way more cells in your prostate than you should, and the cells themselves are bigger or fatter. And all of that leads to an enlarged prostate, or BPH, and then that leads to squeezing on the urethra that passes through the prostate, and that's where all the urinary problems come from. So what you want to do is eat a diet that helps you keep a low normal insulin level for as many hours of the day as possible. And the way to do that, you're going to follow these 7 easy steps. Step number 1 is to avoid all sugar in your diet, whether it's added sugar in soft drinks and desserts, or whether it's natural sugar in high sugar fruits like grapes, bananas, cherries, papaya, pineapple. These things may have some vitamins and minerals and maybe even some magical phytonutrients, but you can get those vitamins and minerals from other sources that have way less sugar, and therefore you're not going to spike your insulin level. Anytime you eat or drink sugar, whether added or natural, you spike your blood glucose, which spikes your insulin level, and that makes you hyperinsulinemic. Then the insulin starts going to work, making your prostate enlarged. Now, this high insulin also has hundreds of other deleterious effects on every other tissue and cell in your body, but in this video, we're talking just about the prostate. Number 2 is to avoid all grains, even whole grain bread and stuff like that. When you start to chew up a piece of whole grain bread, there's an enzyme in your mouth called amylase, which starts to immediately break the starch in that bread down into sugar. So we're back to step number 1. So by avoiding all the grains, whether it's wheat, rice, oats, or corn, all of these things spike your blood sugar, which leads to hyperinsulinemia, which is the underlying hormonal problem of an enlarged prostate. Number 3 is to avoid all soy products, unless it has been fermented by the real fermentation technique, like natto and other things, avoid soy. Soy is very estrogenic, and it's going to make your estrogen to testosterone ratio inappropriate, which is going to lead to increased enlargement of the prostate. Number 4 is to avoid any low-fat dairy product whatsoever, whether it's milk or cheese or sour cream, cream cheese. You want only full-fat dairy, okay? And in some men, they have to go to only the highest fat choices of dairy, like heavy cream, butter, and ghee. Some men can get away with full-fat cheese and full-fat yogurt and kefir, but other men have to just only use butter, ghee, and heavy cream as their only dairy sources, or they will notice increased symptoms of an enlarged prostate. Number 5 is vegetable seed oils. These have a very inappropriate omega-6 fatty acid to omega-3 fatty acid ratio, which can lead to inflammation all over your body, but specifically in the prostate. And when a prostate is enlarged and inflamed, your enlarged prostate symptoms get even worse. And then number 6 is eat a low carbohydrate diet. Whether this is a ketogenic diet or a carnivore diet, eating this diet is going to keep your insulin level low normal for the majority of the day. Okay, and that's the goal here, is to keep your insulin level low normal. You don't want a chronically high insulin level, or you're gonna cause your prostate to enlarge. Then you'll suffer from the symptoms. Then step 7 is intermittent fasting. You want to go without eating anywhere from 14 hours a day up to 18 hours a day. And you don't have to start at 18 hours a day. You can slowly work your way up to that. But when you fast for 14, 16, or 18 hours, that really resets your insulin level back to the low normal level, which is going to not promote prostate hyperplasia. Very, very powerful, very important. Also, intermittent fasting is free. I've got a big playlist about intermittent fasting. It'll pop up right here. You can go watch this after this video is done. So these 7 steps above are going to give you 80% reduction in your prostate problem. Now, it took you years to grow the prostate that you have right now. So don't expect these changes in your diet to have an effect in a few days or a few weeks. It's going to take several months, if not a year, for your prostate to go back to normal size. And because when you eat this way, it's not literally going in there and shrinking your prostate. It's just stopping the signal from the hyperinsulinemia to continue to enlarge. And so when that signal of inappropriate growth goes away and your insulin level goes back to low normal, then as your prostate regenerates and rejuvenates and replaces cells, they're going to be the normal size cell, and it won't replace all of them. You'll have fewer and fewer prostate cells as the months go by. So don't expect an overnight fix with this. You didn't get in this predicament overnight, and you ain't going to fix it overnight. Now let's talk about prescription medications. So there are several prescription medications on the market that your doctor can prescribe for you, and they do help the symptoms. They do not, however, address the root cause, which is chronic hyperinsulinemia, at all. So it's no crime if you want to take one of these prescriptions for a few months while you're letting your low carb, your keto, your carnivore diet have its effect. But be prepared for a long list of side effects. Some are quite serious. Now let's talk about your other hormones, your testosterone, your estrogen, and your DHT. So absolutely, without a doubt, having a low testosterone to estrogen ratio absolutely will increase your risk of having an enlarged prostate with symptoms. But just keep in mind, you will actually see videos out there that say that testosterone causes enlarged prostate. Not true at all. DHT, no, it doesn't cause that. But as a man gets older, his testosterone tends to dip, especially if he's sedentary and especially if he's eating a high carbohydrate crap diet. His testosterone level is going to start to nosedive, and that's going to leave his estrogen level at about the same level. But as his testosterone level goes down, his estrogen to testosterone ratio is going to go up. You see that? So if high testosterone causes an enlarged prostate, then every 18-year-old man running around on the planet would have a humongous prostate because their testosterone is sky high. That doesn't happen. It's only when you get older, your testosterone goes down, you've been eating a high carbohydrate for decades, that's when enlarged prostate happens, right? Now let's talk about the supplements. There are a few supplements, and I'm going to put a link down below if you want to try one of these. Some people report amazing improvement in their enlarged prostate symptoms from taking these. Other people say, didn't really help me that much. The most common are saw palmetto, nettle roots, and pumpkin seed extract. So I'm going to put a link down below if you want to try one of those while you're using the diet to reverse 80% of the problem. Then you can take one of the supplements, and that might be 5% of the solution. So as always, I want you to focus on the 80%. I want you to focus on the root cause, and that's chronic hyperinsulinemia. Remember, the research is down below. If your doctor doesn't believe you or me, you can just show him or her the research and say, well, what do you think about this? If you enjoyed this video, please take 1 second and click that subscribe button and the little bell.
I think this doctor gave us a very clear assistance in how to handle your prostate if you have an enlarged prostate. And I believe this will give us the right kind of information, what kind of supplements you can take, what kind of food to avoid, what is best for you. And you find from this sharing from his, very importantly, once you are diabetic, your sugar level will be very high in your blood, and you're going to keep it as low as possible, and that's the major cause of enlarged prostate. So we'll continue further.
What if I told you that your diet might actually help prevent BPH? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we're going to talk about what changes you can make within your diet to help prevent prostate enlargement. Now, benign prostatic hyperplasia, or BPH, is a condition where the prostate becomes enlarged, and the prostate gland is located underneath the bladder and around the urethra. As it enlarges, it makes it more difficult for urine to pass through, leading to symptoms like difficulty urinating, straining, waiting for your stream to start, having a stop and start stream, splitting stream, and even sometimes having to go multiple times throughout the day or at night, and going very urgently, and sometimes even leaking urine. And BPH is incredibly common. It's estimated that over 50% of men over the age of 50 have some degree of BPH, and that number continues to increase to about 80% by the time men reach their 80s. And today we're going to talk about how your diet can affect BPH and how adding these few things to your diet might decrease your risk of BPH by almost 30%. So there's been two major studies that have looked at large populations of men to look at what dietary changes might be associated with BPH. And the important thing here to realize is that these studies are observational, meaning that you can see that these people who ate these things were less likely to get BPH, but we can't definitively say that this causes or prevents BPH. So the first study I'm going to talk about is called the Prostate Cancer Prevention Trial. And this was a study that included 4,770 men from the placebo arm of the Prostate Cancer Prevention Trial, also known as PCPT. Now, this was a randomized controlled trial that was initially designed to evaluate the risk of prostate cancer in men taking a medication called finasteride, in men who are younger than 55, and they followed these men for 7 years. Now, of that initial study, they looked at men specifically who didn't have BPH at the start of this study, so at the beginning of that 7-year time period, and they looked at how they changed over time. And so that left them with almost 5,000 men. And how they studied these guys is they completed a diet and supplement questionnaire, as well as food frequency questionnaires, looking at 99 different foods they were taking in food groups, as well as 9 beverages. And they calculated then what's called the relative hazard or risk of getting BPH after controlling for how old they were, what their race and ethnicity was, how obese they were, and what kind of energy expenditure they made usually, as well as their other health conditions. So number one thing is increase in protein intake. So in this study, they found that higher protein intake decreased BPH risk by 15%. Now you might say, how much higher? Well, they looked at the total energy percentage of what you're eating. If you were eating a 2,000 calorie diet, what percent of those calories were coming from protein? Men who had more than 19.5% of their total energy from protein versus less than 14.6% of their total energy had a decreased risk of 15%. Now, if you looked at the number of calories, if 490 calories or more were taken from protein versus less than 236, that decreased the risk by 33%. Now, the average person in the US gets about 13 to 16% of their daily intake through protein. So you need to be a little higher than average to reach that 19% mark. All right, number 2, decrease in fat and maybe red meat intake. So in that same study, the PCPT study, it showed that a diet high in total fat and red meat was associated with an increased risk of BPH. Let's talk about the red meat thing. You can't differentiate people who are eating lean red meats from high fatty red meats. So I assume that likely a lot of the high red meat issue is coming from high fatty red meats, but they couldn't differentiate from that, so I can't say specifically. But when you look at the data, when you compare men who ate daily consumption of red meat, meaning every single day, versus less than once a week, they increased their risk by 38%. But when you look at the consumption between 1 to 7 times a week, there was no significant increase in risk. So all I can tell you based on this data is don't eat it 7 times a week, meaning don't eat it every single day. Ideally, I would recommend eating lean red meats because we do know that, again, fat is associated with BPH. So let me tell you the data on that. When you look at diets high in fat, they increase the BPH risk by 31%, meaning those who ate about 38% of their calories came from fat were 38% more likely to get BPH than those that had less than 25% of their calories from fat. Now, why is fat such a problem? Well, the reason behind this is that diets that are high in fat may potentially promote inflammation and cause hormonal changes that then drive prostate cell growth. And not only are they causing inflammation, but they may be causing hypoxia and tissue remodeling, meaning they may actually reduce the oxygen in the prostate and cause this remodeling and enlargement. Our next one comes from a different study, and this study is called the Health Professionals Follow-Up Study. Now, in this study, they looked at over 32,000 men who were health professionals, doctors, dentists, veterinarians, pharmacists, and they collected some baseline data in 1986 using sort of a semi-quantitative food frequency questionnaire. And they wanted to look if they consumed any of over 131 food items, as well as looking at what vitamins and supplements they took. Then they followed them from 1992 to 2000. So these men were followed for a long time, and they wanted to see if they had any symptoms or surgery related to BPH, and what were the odds of developing BPH based on these dietary factors. And again, they controlled for age, body mass index, smoking, alcohol, and in this case, protein intake, energy intake, and polyunsaturated fat intake. So that brings us to number 3, which is increasing your vegetable intake. So in this study, they found a 32% decreased risk in men who consumed 6 or more servings of vegetables per day compared to less than 1.6 servings. And in particular, they found that fruits and vegetables that were rich in beta carotene, lutein, and vitamin C reduced the odds of BPH by anywhere from 11 to 17%. Now, you may be thinking vitamin C, I can take that as a supplement. However, they did look at vitamin C in foods versus vitamin C in supplements, and they didn't see the same impact when taking vitamin C in a supplement form. Specifically, when you're looking for foods that are rich in lutein or beta carotene, you want to look for things like cooked spinach, raw spinach, peas, Brussels sprouts, and peaches. Also, things like oranges, grapefruit, or fresh orange juice or grapefruit juice was also seen to be beneficial. Legumes like string beans, peas, beans, and alfalfa sprouts were shown to be beneficial. And cruciferous vegetables like broccoli, sauerkraut, coleslaw, cooked cabbage, cauliflower, again, Brussels sprouts, kale, all those things were shown to be, again, beneficial for potentially preventing or having a lower odds of BPH. Other vegetables were things like corn, mixed vegetables, mushrooms, yams, iceberg lettuce, romaine lettuce, and garlic. So a lot of vegetables. And so a lot of them were associated with a lower odds of getting BPH. Number 4 is zinc intake. Now, not from a supplement. In fact, zinc supplements didn't show a difference, but higher dietary zinc was linked to a reduced risk of BPH, with men taking more than 18.9 milligrams per day having a 32% lower risk compared to men taking 8.8 milligrams or less. So you might be wondering what kind of foods have zinc in them. Well, first off, oysters. 2 oysters contain almost 12 milligrams of zinc. Pumpkin seeds. 100 grams of pumpkin seeds contains almost 8 milligrams of zinc. So 100 grams of beef contains almost 5 milligrams of zinc. And almonds, a 100-gram serving of almonds contains almost 4 milligrams of zinc. And other sources can be things like hemp seeds, chickpeas, lentils, sunflower seeds, or chia seed. Which leads us to our last item, which is flax seeds or flaxseed extract. So in a small study of 87 men, they found that flaxseed and its active component, psychoisolycerus diglycoside, I don't know if I'm saying that correctly, can help reduce the risk and symptoms of BPH. So in this study was a randomized double-blind placebo-controlled trial where they administered either placebo, 300 milligrams or 600 milligrams per day of the flaxseed extract containing that SDG to 87 men and followed them for 4 months. And after 4 months, they saw that their score of urinary symptoms called the IPSS, as well as their quality of life scores, improved. So they noticed that their symptoms went from moderate to severe to mild. And while that may not seem like a big deal to you, I would say a lot of patients would love to go from moderate to severe symptoms to mild without having to undergo surgery or other procedures. Now, this is a very small study. It's only covered 4 months, but it may be helpful in some patients. Bottom line, I think there's so much that we can do for our health to improve our quality of life and hopefully prevent chronic conditions like BPH. I hope there's more investigation into this area of prevention because I think it's so important. With 80% of 80-year-olds dealing with BPH, I mean, it's really important for us to try and find ways to prevent it. If you guys enjoyed this content, make sure to check out my podcast. It's here on YouTube, but you can also find it wherever you listen to podcasts, whether it's Apple Podcasts, Spotify, or any other application. It's the Rena Malik MD podcast because sometimes, let's face it, you don't have the time to watch a video, but you can always put your earbuds in, go for a walk, or listen to it in the car and hear a podcast and learn something that's going to help your life and help you feel better, have better sex, and overall live a better life. So as always, remember to take care of yourself because you're worth it.
Question is, if you go for a checkup and you find that your prostate is enlarged and the BPH is very high, you go for a PSA check, you found that you have prostate cancer. And this is what I want to talk to you about because it's important right now to deal with it. If you look at the statistics here, as far as cancer is concerned, number 1 in the world is breast cancer. Number 2 is prostate. So for men, it is prostate. For women, it is breast cancer. If you ask what is the original cause, nobody can say for sure. Sometimes it could be environment, sometimes it could be stress, sometimes it could be the food we take, sometimes it could be some other unknown causes like hereditary, we don't know. The thing is that it is very high, almost 60% of this cancer is from prostate. Yeah, so we have to pay attention to this, and you can see that this another pie chart to show to you the different kind of cancers and then how much does prostate contribute to men. Yeah, so you can see that it's quite high as well. This part will talk about the symptom of prostate cancer. Number 1, if you continuously want to run to the toilet to pee, you cannot hold it, you have to run to go and pee. That is the first sign that you got to take notice of. Number 2, you find that you will be standing at the toilet bowl there for a long time before the urine can come out, and when it comes out, it becomes very weak, the flow. And for some people, they have blood in the urine or blood in the semen. That means there's a brownish color in the urine or the semen after you have sex, or what. Number 5 is you always have to rush to the toilet. You go for a tour, the first person to go to the toilet is you. So this is the sign, yeah. And then for some people, there may be pain in the testicles. But whatever it is, the best way is to go for a PSA check. And once you go for the PSA check, you will find that the doctor will be able to diagnose you the 4 different stages of prostate cancer. It's very important to take note here. First stage, define the tumor, but it is very, very small. Second stage, you find that there is more than the first stage. It's in a few places. Third stage, the prostate has spread outside the nearby tissue. so it goes to other places as well. And the fourth stage is, that means it's gone to the bone, gone to the organs like your lung or your liver, you know. That's not very good when it is fourth stage. There are various forms of prostate cancer, but very importantly, we will define as aggressive and non-aggressive. Non-aggressive means you have the cancer, it's in your prostate, but it is very dormant. It's dormant, it is not much activity, and there is less cause for concern. But the other type is very aggressive. That means it is spreading very fast. So these are the two forms. Either it is aggressive or non-aggressive, and also depending on which stage you are in and what type of treatment you want to make. Yeah, these are the treatment available: radiation, hormone therapy, chemotherapy, surgery, immunotherapy. Radiation is they use the gamma ray hit on the part where hormone therapy is you take medication to reduce the hormones that affects the growth in your prostate. Chemo is putting poison into your system to kill the cancer, but sometimes it kills the good cells as well. And the next one is surgery, cutting it off. And if you are in the third stage, you need to treat it because it will spread very fast away from there. But if you're in the first, second stage, there are other ways to treat it. And the last stage, immunotherapy, I will give you more on that because this is something that I have some information about. It's important to find out early, because if you discover it early, the chances is that you can save yourself from getting it in the fourth stage, and it can help you to live longer. Or you can get rid totally of the cancer if it is in the early stage. Yeah, there are many ways to treat it. Early low grade prostate cancer, that means it is very small in your prostate. There are ways to treat it, but you got to choose the right method for yourself. With that, you got to consult your doctors, and sometimes you got to get second or third opinion, because some doctors are very unscrupulous. They may want you to do surgery, or they may want you to do chemo, or they may want you to do radiotherapy straight away, you know, radiation straight away. You should have the option of what to do. Traditionally, people use radiation or drugs to kill the cancer cells, and it has many side effects. Today, there's alternative treatment like immunotherapy, which can help to kill the cancer. I know many friends who actually use this method, and you find that they survive the cancer. Yeah. So I'm going to help you to understand this. Immunotherapy is meaning that you eat the right kind of food that can help your body to boost up your immune system to fight against the cancer. I just want to give a testimony to all of you here tonight who are here in this meeting. I do research on this very much during COVID-19, because during COVID-19, in the early stage in the year 2020, I did not take the vaccine. I was living in Malaysia, and many people got COVID-19. And when I came back to UK, I find that, wow, here even worse. Every day 5,000 people die because of the COVID-19. And my wife took the vaccination. I did not take the vaccination. So I cannot be a sitting duck waiting for the disease to strike me. So I begin to research on how to help the immune system, and I discover some amazing things in the process. It's already almost 4 to 5 years since COVID-19. During this time, I learned something very important. In UK, during winter, many people get flu, get cough. All these are the common symptoms of the winter, you know. Like my doctor just messaged me that it's time for me to take the flu jab, which I've not taken for a few years already, because basically I do get flu during winter. But today I can tell you that I don't have that symptom at all, and my high blood pressure is gone. My sugar level has gone down very low. So everything has improved because of boosting the immune system. In the picture here are some of the things that can help in the immune system. You can see pomegranates, blackberry, chickpea, oranges, grapefruit, kiwi fruit, pumpkin seed, sunflower seed, capsicum, broccoli. All these are very good for boosting the immune system. Treat cancer of different forms alternatively. Some of the people who can afford it take porcupine date, because porcupine date is the best for improving your immune system. It can improve the immune system, boost your palates, liver detox, improve the skin, increase body resistance, improve dengue fever, fast healing, improve cancer, natural way. And I believe that this has helped a lot of people. I've known of many friends who actually got cancer and they take porcupine date, and until today they are still alive. So this is kind of proven in the sense that people who take it, they survive. It doesn't mean all. Some people still die after taking it. There's no guarantee in anything that you do. And the next thing that I found out very, very useful is actually the papaya, the common papaya you have in Malaysia, in Singapore, in Asia. I don't have here, and I take papaya almost every day here as well. I try to buy, even though it's expensive. One papaya will cost me about 30 ringgit, small papaya. The leaves of the papaya is amazing as well, and so are the seeds. And research has found out that this can beat cancer. This is one of the things that can beat cancer. Some of the recommended supplement you can take is vitamin B12, which is a very important form of vitamin that can help in treatment of cancer. Sodium bicarbonate is also another important criteria to use in the treatment. So I'm suggesting to you things that people use, but it's all an option to you if you want to use or not. And this is expensive, where people go on high dosage of vitamin C infusion. This is expensive, can go to a few hundred thousands to treat cancer using this method. I don't know why it's so expensive, but it works. Today I have a few friends who is using this method still alive after 5 years of 4th stage cancer, 4th stage, and they're still alive because they use this method. Another thing I want to recommend to you is mushroom. What type of mushroom? Turkey tail, cordyceps, linzi. These 3 mushrooms is found to react positively towards cancer, and it is proven, and now they are doing scientific research on it. This is something that can help you very much, mushroom. The good news is, you see, these are all the different stages of prostate cancer. Stage 1, 2, 3, 4. You can see it is a very high survival rate, 99%, 97%, 96%, 94% if you treat it, Not like breast cancer, which is much lower, The women who get breast cancer normally is spread to other parts of the body very fast. But for men, it is really very fortunate that it is very treatable. So you need to find out early and do the right things, I've finished here, but I'm going to pass the time to Brother Eddie, which has something very good to help all of you as well. There are different methods, like I say, to treat. So what I share with you through natural herb is all those things that I recommend to you. Vitamin C infusion, taking porcupine dates, vitamin B12, the 3 different important mushrooms, as well as sodium bicarbonate, and very importantly is the papaya leaves and the papaya seed. This is very, very helpful. And for those of you who have prostate problem, you can WhatsApp me and talk to me. And if you do have cancer of the prostate, you also can privately talk to me. I won't talk to you in the open platform because we need to have some privacy. You can talk to me, and perhaps I can help you in certain ways on how to actually treat it. There are other things that can be done, but I won't be talking about it here right now. But I believe that there are different methods to treat it. And one of recently, I was told by Eddie, one of his friend actually has got prostate problem, and what the friend told him that he took something that can help, that helped him so much, you know. So I think you should listen to him, what he has to say regarding this product that can help you. Yeah. So Eddie, I pass it down the time to you.
Which is I've came across recently, and what happens is this was recommended to me. It's a supplement, you know. But before I talk about this supplement, I want to share, since this is a platform that is talking about prostate, prostate. Let me just recap maybe in a different way what Reggie and some of the video talk about prostate. Actually, prostate, the prostate gland is actually a walnut-sized gland in the male reproductive system that produces fluid for semen located in the pelvis. So that's why I'm talking about pelvis exercise. Is inside the catchment of the pelvis. It sits below the bladder. The bladder means where the urine is. That's why the prostate problem is very related to urination, because it's just next to the bladder, you know. It sits below the bladder in front of the rectum and surrounds the urethra, the tube that carries urine, semen out of the body. So it's so related. These three things, the bladder, the prostate glands, and the urethra. That's why it's centered around here. And I found out also from Googling, from AI, from ChatGPT and AI, prostate cancer is the uncontrolled growth of cells in the prostate. Means our organs are their cells. So when it's out of control, there is problem already. A gland in the male reproductive system located below the bladder is one of the most common type of cancer that often grows slowly, not fast, slowly. In its early stage, prostate cancer may not cause any symptoms. We not even have the symptoms. Brother Reggie have shared about symptoms. Sometimes it's not so obvious, but sometimes when you become more serious, those symptoms are real. No, I've seen people who keep on running the toilet. As Reggie was saying, when we are in UK, Ronnie, every 1 hour he must go to the toilet. He was like cannot control. No, he must look for a toilet, and that's why we found out that he got prostate problem. You know, so this is the thing. So I did some statistic research. It says that 1 in every 6 men get prostate cancer during his lifetime. 1 in 6 is very high, you know. And they say that there are over 2.5 million survivors of prostate cancer across the US. So out of how many 2.5 out of what total, I don't know, they didn't say. But it is a good news, because it means to say there's high survival from people who suffer from prostate cancer. So that is a relief, even though 1 in 6 people get prostate cancer, but the survival rate is also very high. How many percent, I don't know, but 2.5 million is a very high number. So the survey says 5 things that I think is quite relevant to what we are talking tonight. 68% of men know someone who has prostate cancer. Means 7 out of 10 people know somebody. I know many people, my friends who have prostate cancer. So where people know about it, but people don't want to talk about it. You see, 1 in 4 men have never discussed a prostate screening with a doctor. Even though they have things that the symptoms of prostate, they never talk about it with the doctor. So that's why doctor don't know. 53% of men never worry about getting prostate cancer. Even though 1 in 6 will get prostate cancer, but 53% of men, they don't want to talk about it, or they're not worried about it, you know. So there's more than half the men not worried about it, even though the percentage is high. And 42% of men are not familiar with the warning sign of prostate. Just now, Brother Reggie mentioned all the symptoms. When people have that type of symptoms, they choose to ignore it. They think it's normal, but it's not normal. So we have, especially men, you have to look out for those symptoms, those signs of prostate problem that is mentioned by Brother Reggie, like running for a toilet, keep the frequency, and every time the person empty the bladder, it doesn't feel like completely empty. You have to keep on going back. They feel, even though it's empty, they feel it's not empty. Because you know why? Because the growth, because the prostate glands have grown so big, it actually pressure into the bladder. When you pressure the bladder, it sends a wrong signal, even though the bladder is completely empty, but it still have a feeling it's not empty. So that is what causing people keep on, and also when they run to the toilet to pee and they found out there's no more urine coming up because it's actually empty, and they still want to force the urine out, that is a problem. And 45% of men are uncomfortable with the idea of rectal examination. Sometimes you go to check this, the doctor may put a finger into the rectum and all these things. So some men don't like the idea, so they don't want to go for the examination. So you see the chart, just how Brother Reggie mentioned about the age. Actually, this is a chart of the rate of new prostate cancer by group done in the United States in 2019. It says that in the per 10,000 people, you see the graph from 50 onwards to 85, you see the graph shoot up, especially you see very high is 65 to 90, the steps even steeper and steeper, So you see that, so this is what they call age-related sickness. It's an age-related, okay? So let me explain a bit more to you what is prostate cancer, which I'm not a doctor, as Brother Reggie said. I'm not a doctor. Now with technology, with AI, we can actually find out a lot of things in the internet. The exact cause of prostate cancer is not known, but research have identified several risk factors and biological processes that increase the likelihood of its development, and these include genetic, hormonal, and environmental factors. So these are three factors. Let me talk about tonight. I will concentrate on the genetic factor, and it will lead to something called DNA. Okay, because this prostate cancer have everything to do with DNA. Okay, so the genetic factor is a DNA mutation. Prostate cancer begins when cells in the prostate develops changes in their DNA. So it's actually about DNA, While healthy cells grow and die at regulated pace, mutated DNA causes cells to grow and multiply uncontrollably, forming a tumor. So just now, Brother Reggie talking about stage 1, got this tumor, 2 more tumor, stage 3, stage 4. So the question is, how did a tumor form in the prostate glands? So the explanation is already here. It's caused by when the cells in the prostate develop changes in the DNA, and the healthy cells grow, and the mutated DNA cells causes the cell to grow, multiply uncontrollably, forming a tumor. So when the DNA causes the cell to grow out of control, the tumor is formed. So that explains it. So therefore, we can conclude that the DNA inside our cells are subject to damage as we live every day. We are living every day, but you know that our DNA is damaged, caused by these factors. So I concentrate tonight on this factor, on the DNA. How did our DNA get damaged without our knowledge? Okay, but before that, a lot of people heard about DNA, but never really understand what's the DNA. And because of I taking this supplement now, which I'll tell you what is the supplement. I start to research what is DNA. I start to research many things about, because this product is related to DNA. Later I'll show you. So let me give you a short explanation. Some of you may be better than me, that you know what's a DNA, but for those who doesn't know what's a DNA, let me tell you what's the DNA. This is from my research, you know. So DNA, that is what that long name I don't want to pronounce. It's a type of molecule found in the nuclear. Means our cell have every cell got one nuclear, okay, that contains instructions for the cell and determines the trace of the organism. Means the DNA is inside every cell. In every cell, there is a DNA, okay? And inside the cell, you have chromosome, okay? Chromosome is an X, no? And you have tip, okay? Tip. And the tip of the chromosome is called telomere. Okay, some of you it's Greek to you, but these are all the technical scientific terms. So, and inside the chromosome is a DNA. It's like a spiral. It's called a double helix. So this is called a nuclear DNA inside a nuclear, okay? But do you know that there is another DNA, and this DNA that you see, the double helix, the spiral here, is actually made of the father and the mother DNA. That's why the person DNA will have a father and mother DNA inside this inside the DNA cell. But do you know that I found out there's something called a mitochondria. I never know what's a mitochondria. You know, inside the cell, inside this cell, this is the cell, this is the nuclear, but there are things around this nuclear now. And these things are this structure here is called a mitochondria. Okay. And inside the mitochondria got DNA one. But this DNA is circular, it's like bracelets, you know. This one is long string, but this one is circular. This is called mitochondria DNA. And what is this, though? So I researched more and I found out the mitochondria DNA is actually a maternity inherited. Means this one is from the mother. And there are thousands of our cells are inside, we only have one nuclear DNA. But we have 1,000 what they call empty DNA, means is mitochondria DNA, and this is from the mother. It means this: if a man have two wives, okay, so they have children. The first wife got children, he have children first wife, children with second wife. All the children will have the same nuclear DNA, okay, inside the nuclear one, okay. But the children of the first wife and the children of the second wife have different mitochondria DNA. The first wife children will have the mother's DNA, the first wife DNA. The children of the second wife have the second wife mitochondria DNA. So therefore, in our body, there are two types of DNA. One is a nuclear, one main one, but there are thousands inside the mitochondria, you know. So these are the DNA. So when you talk about DNA damage, we are talking about two types of DNA damage: the nuclear DNA and the mitochondrial DNA damage. Okay, so also inside from my understanding now, after reading out all these things, inside our cell, this cell which is so small, but is surrounding the cell, there are something called sirtuin. There are 7 types of sirtuin. You can Google it later. What is sirtuin? There are sirtuin inside each cell which extend the lifespan of all body and organism and have a central role in cellular survival. What it means to say how long you live on this earth depend on the condition of the sirtuin in your body. So if you imagine in every cell, there are thousands of these cells. There are all these things floating inside one cell, and they have sirtuin. You see, God is so great. I was always telling people, people are so marvel about outer space. Oh, I want to go to outer space, go Mars, Jupiter. But the inner space is even more complex than the outer space. God has made us and put this sirtuin inside a body that determines the lifespan of a person. Any one of us, if our sirtuin is strong and healthy, the longer you live. If the sirtuin is weak, your shorter life you live. That's all, very simple as that. Okay. So the next thing I'll talk about is this sirtuin can only be activated. So we're talking about how to activate, make it more stronger and healthier, so they will extend the life. Is activated by something called NAD+. I don't know what's NAD plus until I started to research it about 1 month ago, okay? And it's a precursor. Precursor means something that will cause the NAD plus in the body to increase. So just now, Brother Reggie has shared the food you eat that can increase, can increase what they call to make the body stronger, to help the body to prevent what they call prostate cancer problem. All these fruits you talk about, nuts, vegetables, inside, do you know that inside the thing we eat called nutrients, this goes in the body, can help a body to produce something called NAD plus. I will explain to you what's NAD plus soon. So therefore, NAD plus is like that. If you stop breathing for 2 minutes or 3 minutes, you stop breathing, what happened to you? You die, okay? If the body don't have NAD plus, your cell die. Simple as that. So this NAD plus is something very important for body, and yet majority, even including me, don't know about what NAD plus. So let me tell you what is NAD plus. This is from AI. I didn't write it up. I purposely copy from AI and tell you. NAD plus is nicotinamide adenine. It's long word, okay, I don't try to pronounce it. NAD plus is a crucial coenzyme. What is coenzyme? Coenzyme means it is an enzyme that works with other enzymes in our body, found in all living cells. Means all the living cells, not exception, everyone will have NAD plus. It plays a vital role in various cellular processes, including energy production. Okay, from this, I realized we always tell people, hey, you are weak, you must eat something like especially after you recover sickness, hey, you better eat this, eat that, so that you can recover energy. So when we say that statement, we never understand eating something and energy, how does it correlate? No? How do you eat something have energy? Because when you eat something, you increase the NAD plus in the body, and the NAD plus role is to make energy. I will explain to you later again a bit more. NAD plus energy production, DNA repair. So the NAD plus is so important. It repairs the DNA, and cellular signaling means telling the cells to coordinate the cells. NAD plus level naturally decline. That is a bad news with age, contributing to age-related disease, including prostate cancer. Okay, let me just go to this part. I don't want to read everything. NAD plus and aging. Reduced NAD plus level are associated with age-related conditions like metabolic disorder, cognitive decline, and cancer. So some people is asking, why people kena cancer? Why this cancer? Why people have this type of cancer, different type of cancer? It has to do with the NAD plus that have reduced or become very low. So restoring NAD plus level through supplementation or boosting its production in the body may help combat these age-related issues and promoting healthy aging. My brother and sister, you can age healthily. Don't have to be sickly and start to age. When you age, you are sickly. You can age healthily. Your body can be 60 years old, but biologically, like myself, I just humbly say this, I'm 69 already, but my body is 58 only. Okay, my body is 58 years old. That's how when I stand out on the equipment, they tell me, So you can have something like me, 69, but your condition, the body composition is younger. I'm 11 years younger than my actual age. So, and there's something called ATP. So tonight you learn something. Some of you already know, but there's something called ATP. ATP, NAD plus is crucial for converting nutrients into cellular energy. So the energy, just now I talked about when you eat, when you're sick, you take food, you have energy. It is NAD plus converting the nutrients into ATP. What's ATP? ATP is adenosine triphosphate. It's a molecule that serves as a primary energy carrier for cells. Means this is something like a battery, battery giving power to all the cells. It's often referred to as the energy currency of the cell because it provides the energy needed for various cellular processes. Means when you wonder where is my energy coming from, my brothers and sisters, is from something called NAD+. The NAD+ goes in and convert and not only repair the DNA, but it gives you the energy and it produces something called ATP. So you have to do your homework and Google all this and find out what is all this thing about. So let me summarize it very simply. NAD+ major function in the body, 5, okay? Provide energy to all cells. Activate the longevity protein sirtuin. The sirtuin 1 to 7, just remember, the NAD+ will activate the longevity protein of the sirtuin. Third thing, it restore the mitochondrial youthfulness. So a lot of people, after using this product that we shall talk about later, looks younger. They look younger, because actually because of the NAD+ increase, it started to repair and restore the DNA and start to reverse the age of the DNA. That's why they look younger, because you remember when you are 20, 30 years old, you look so young and so pretty. No, you know why? Because your DNA is very strong, okay, very powerful. And when you grow older and the DNA start to get damaged, guess what? Aging start to come in, especially after 40. For men, it's 50, women maybe a bit earlier. You see the aging, the wrinkles come out, the white hair comes out, the balding happening. All these are because the DNA is damaged. So the fourth thing that NAD+ does is repair the cellular DNA damage. Okay. Fifth thing, turn off the genes that's accelerating aging process. It means that sometimes in a body, due to they call disposition, the misformation of cells, some cells are no longer helpful. They have to be disposed of from the body, because if this type of cells that is malfunctioning and malformed stays in the body, there's a high chances of cancer happening in the body because it need to be taken out. So this NAD+ job is to take out all these genes that's causing the aging process. So therefore, let's look at the red words. When NAD+ is absent in various cells, metabolic activity, it will cause the cell to gradually mutate or even die. So you see how important is the NAD+ in the body. Let me make it easier for you to understand the role of NAD+ in the body. NAD+ is connected to important processes that are vital for cellular health. NAD+ helps the cells to make ATP. So without NAD+, you have no energy, you have no ATP in the body. So the next thing is NAD+ is needed for DNA repair. So you want to repair your DNA, you must increase the NAD+ in the body. Okay, and also all the 7 types of sirtuin are then activated. So you see the importance of NAD+. So you must actually take food that help your NAD+ to increase naturally. Okay, but thank God we are now in this age of technology when human beings are getting very smart. They can find out a lot of things that 100 years ago nobody knows, and they found out a thing called NAD+. So let me show to you the root cause of aging and sickness is actually reduced or low NAD+ in the body. Let's talk about the root cause. In every problem, if you're only taking medication or supplement to treat the symptom, that's the problem. If when medication, your headache, they give you Panadol. You got diabetes, they give you metformin. You have stress, they give you certain things. So we actually addressing the symptoms of the sickness. But the answer to the problem is actually find out what is the root cause. The root cause is actually damaged DNA and reduced NAD+. That is the problem. So if you keep on addressing the symptom, you'll never get healed. but you find out the root cause of your sickness or your problem and deal with the root cause of the problem, that's where healing and recovery comes in. So it says that when you damage your DNA, and slowly the organs will slowly start to fail and diseases begin to surface. The consequences and the manifestation is things like that. Prostate cancer, sarcopenia, osteoporosis, joint pain, cancer, spleen, kidney, diabetes, stroke, mobility, disability. So all these things that you see, the manifestation is actually caused by the damaged DNA in your body, and you'll be surprised that I'll show you a chart. Really, you'll be surprised how our NAD plus drops with aging. So thus, to prevent getting age-related diseases, including prostate problem, we must increase the NAD plus inside the cell. Logical or not? It's logical. Because if NAD plus, which is so important, which I just explained to you, then you know this is the answer to the root cause of all your problems, the sickness, then the answer is take something that can, whether it's from a supplement, from the food you eat, and the natural food you eat, by all means, increase the NAD plus in your body. So this is very interesting. NAD plus reduces as we age. You see, when a baby is born, let's talk about 0 to 10. From 0 to 16, this lady should be somewhere 16, okay? So the NAD plus is starting to drop from 10, and why does it drop? Because the NAD plus is used tremendously for us to build up our body and grow. We are in the adolescent stage, we are growing now. But once a person hit 20, you see this guy, 20, you know, the NAD plus start to drop, no? Why? Your question is why? First of all, as we know, the food that person eat. Secondly, the lifestyle. If there's not enough rest. And thirdly, the environment he's living in. Maybe it's a polluted area. The food is not healthy food. The water he's drinking is not healthy water. No, it's no good. But because he's young, at 20 years old, he can still be still very strong. But you see, once you hit 40, you see the NAD plus goes down to about 2, 3 or 2. And as we age under 80, that's why sickness, all types of age-related sickness start to surface, especially when you hit 50, 60 years old. You start to lose energy, you have no strength, you cannot do this, there's no stamina. So what's the question? Because the NAD plus have dropped to a low level and people don't know, you need to supplement the NAD plus with either food you eat or supplement that is available in the market now, because we thank God they're living in an age of technology. In the Bible, those who are Christian know, in the book of Daniel, God revealed a lot of things in the future to Daniel the prophet. No, but Daniel cannot understand. You see, I cannot understand. So, and God told Daniel, you rest, go and rest now. Because in the last days, we are living in the last days now. No? He said knowledge will increase now. That is what God said to Daniel. You go and rest. Don't worry about this. I will raise you up when the time comes. But in the last days, knowledge will increase. So this is in fulfillment of God's word. That knowledge have increased to a span of man, able to find out something called NAD+, which is not known at all 100 years ago. You see, way back in 1926, 1929, people are starting to find out what is NAD+. They found out something called NAD+. These are the three gentlemen that have found out. They are the NAD scientists. But they found out, but they don't know what to do. There's only in 216, this Professor Dr. David Sinclair, he did something more than that. He found something to be able to help to reverse aging using a product called MNN. But now we are living in a time, the breakthrough discovery about 10 years ago as a dietary supplement, something called AKG, alpha ketoglutarate. This is a latest invention. They know about this, but they have not been able to come out with a product that can use as a dietary supplement. So this is what we are talking about tonight about this. Let me explain to you a bit about AKG. AKG supplements supplement increases the NAD plus. We have been talking the whole night about NAD plus, and therefore increase the ATP in the mitochondria. This is what we want, ATP is the energy for every cell in the body. The more ATP, then the longer the cells lives. Without ATP, we can't even form a thought in our brain or move a muscle in our body. The importance of NAD plus and AKG can do that. And in the 2020 Harvard Medical Doctor and Biological Technology Science Hong Bin Chan published in his animal experiment in many medical journals, as I saying that a lot of tests have been done to make sure that NAD plus is good and safe. He showed that feeding AKG for 3 to 5 months in mice can increase the level of biological substance, that is NAD plus, and also activate the sirtuin inside the DNA. Therefore, the higher NAD plus in the cell inside the human body, the restoration and the maintenance of healthy DNA will help in prevention of most sickness in the body, including prostate cancer. So therefore, NAD plus can restore and maintain and make the DNA healthier. And if that happens, it prevents a lot of sicknesses in the body, which includes prostate cancer, which we're talking about. So let me talk about the evolution of nutrients and supplement. We know that supplement and nutrients have gone through different phases because of technology. So let's call it 1G. The first that came to the market is called the macronutrients supplement, like protein powder, fiber. This is for people who have sports, they want to build the body, they have the macro nutrients. Then the 2G is the micronutrients like minerals, vitamins, supplement, deficiency, for deficiency like calcium, iron, vitamin tablet, A, B, C. This is called 2G technology. Then we come to 3G. It's more specific functional supplement like stem cell, deep sea fish oil, ginseng extract, etc. That is called 3G. Now we have 2016, as I say, Professor Dr. Sinclair come out with M and N. This is called 4G. 2016, 9 years ago, improved the cellular level like resveratrol, MNN, and he actually started to talk about reversing aging up to 6.5 years. Let me tell you what's the difference between reverse aging and anti-aging. Anti-aging is like, for example, you are 50 years old and you taking something that stop aging. You are 50 years old, 5 years from now, 6 years from now, 10 years from now, you are 60 years old, we are still 50. This is called anti-aging. But if you're talking about reverse aging, it means what? No, you are 50. You take certain things and increase the NAD plus to such a high level, you become 40, 30, 20, I don't know say that, 40, 30, So you see, NAD plus is such an important thing. But now we're talking about one more thing, it's called 5G. 2 years ago, last year in fact, this AKG repair, improve, and maintain DNA integrity. And this time they're talking about reversing age from 8 years to 34 years. If you can increase NAD plus to a high level, you can actually start to reverse the age. So now finally, I want to introduce what I have found that really helped me to start to research all these things that tonight I've shared with you. This product is called Hygo GN. GN stands for gene, AKG, which is totally safe, completely with no side effect, 100% American research development, 100% American formula, possesses intelligent sustained release. What it means to say that a lot of things that we take a supplement or food, we eat in the mouth, it goes stomach, it come out either in urine or or what they call our sheet lah, our faces lah. But this product claims to have a sustained release, means it doesn't release straight away into to be disposed of. It goes into the cell. It possesses intelligent sustained release, high purity, high gold GN AKG, sustained 24 hours, and to ensure it's not destroyed in the stomach and circulate in the blood without being filtered by the liver, and therefore greatly improve absorption rate. And this product have all these certification on the bottle. Is FDA. FDA is not approved because this is not a drug, it's not a food, it's actually a supplement. It is manufactured under the FDA control facility. Then they have this cert. Let me okay, this one the word you cannot read very clear. It's actually restoring and maintaining DNA integrity, healthy aging. So this product here have CGMP, is current good manufacturing practice. And another here is non-CMO, means this product is not genetically altered in any way. So this is the product that I've used. And now I want to stop share and invite my friend James Ui to come and share a testimony about this product that he have used.
I'm not going to be like the two speakers, tell you all those scientific terms, AGB or whatever it is, okay? I'm going to tell you stories. Do you like stories? If you like stories, please key in 111 and let me know.
I will like story. Go ahead, brother.
Yeah. Okay. Now, this is a true story, what we call it, Sabana. 3 months ago, I had this severe pain on my testicle. Not only pain, it's swelling, it's swollen, until the size is about a size A8, a big and extra 8 size. It's quite big, and it's hard and also pain. So as usual, I went and see GP. He said, "Oh, this is small issue. I'll just prescribe you antibiotic. So should be okay after 3 days. If it's not okay, come back to me." Well, after 2 days, it still doesn't help. It's regarding the prescription that the doctor gave to me for my swelling testicle. So after 3 days or after 2 days, still pain and still very big. So I go back to the doctor. He say, in that case, I have to give you the antibiotic jab, but you have to come to my clinic twice a day, one in the morning and one at night. So okay, so I'll just listen to him. After 2 days of the jab, still doesn't work. So he says, "Oh, I think I better do a blood test for you." So the blood test says, "Oh, this is severe infection." After that, he says, after he says, "In that case, your case is quite severe. I would suggest you to go and see a specialist." So I went to see a specialist whom I know him also. And he told me, "Oh, this is mostly caused by infection, but the doctor gave you a wrong prescription." They suppose, because, in antibiotic, there are two, lower respiratory tract and also upper respiratory tract. So they give me the upper one. So it should give me the lower antibiotic. Anyway, so he says, "I have to change your antibiotic for you. You take it for 10 days. Then he gave me another jab again." So after that, he says, after the 10 days, if the if the pain is still there, okay, you have to come and see me. Maybe we'll do some surgery or whatever it is. But he was telling me, he says, "By the way, let me remind you, the swelling of your testicle will not reduce that fast. It will take at least 2 to 3 months. And one of my friends had this issue. It actually take him 6 months to make the swelling back to normal, So doctor, I said, because I said, "Doctor, this is very long time. What to do? So I have to bear with it." And then after that, I went to see a friend who is also a pastor. Look at me, says, "What happened to you, James? Why you look so pucat? Why you look so pale?" I say, "Pastor, I've been taking antibiotics for almost 10 days, I have this issue." So he says, "Why don't I think I want to recommend you this this product, you try take it. I say, what it is, you know? He said, because he himself got prostate issue. He's age 72, and he used to wake up at night to pass urine. And then after taking this for a week, he actually can sleep very well the whole night through, and it doesn't give him this frequent urination. So he says, you take it lah, you know. Then I say, okay lah, take it, because it's, so I said, oh, it's quite costly, yeah. So I say, go in mind, I'll take it. And then I say, most important, it will help to reduce my swelling, because it's very uncomfortable, you know. Anyway, after taking this product for 5 days, the swelling reduced back to normal. And I'm so surprised that the whole day I'm trying to touch. Am I dreaming or not? Because doctor advised me, he says the swelling won't go down so fast, at least 2 to 3 months, you know. But this one, 5 days gone, no, back to normal. You know, then the next day I went to see doctor. You know, then the doctor say, oh, your swelling is gone. How come? What do you do? Because I never tell him what I take, really. So he was saying, you know, yours recover very, very fast. You don't have to come and see me anymore, you know. You can stop all your medication. He said, I'm so happy that, you know, after taking this, the 5th day only, the swelling reduced back to normal. Can you imagine? Where doctors telling me it will take at least 2 to 3 months, friends telling me it will take at least 6 months, but for me, it only takes 5 days. So this is amazing product, you know. So earlier I was telling to my friends, oh, this is quite expensive. But later I received this so-called statement. It says, if you think health supplement is too expensive, try the cost of a hospital bed, you know. So that's my sharing. Thank you.
Thank you, Brother James, for sharing. So basically now my job is tonight is to tell you availability of a supplement in the market. This AKG product, there are many brands lah. So the brand we are talking about is made in USA. This product we are just shared is made in USA lah. So it is certified and is well accepted now. Even 1 year itself is doing very well lah. So basically that's all. I'm merely providing you another way for those who want to have prostate problem, can consider this supplement now. Okay, Brother Reggie, I will hand the time back to you now. Okay, thank you.
As usual, normally in my health talk, sometimes I come across a product that works, then I will recommend it. All right. Basically, I don't sell anything. All those things that I show to you is available from the market. You know, all the supplements you can get in the marketplace. But some of these are introduced to you. Like for example, I've done the talk on arteries. There are certain products that you can actually get it yourself, but some you can't. Then I will ask somebody to introduce to you. Like in this case, is actually Eddie. They are marketing this product, so I think it's a good product. So I ask them to talk about it, so that if you're interested, then you can purchase it from Eddie or James, you know, for that matter. I just help people to coordinate with other people so that you can get some help. Yeah, I'm sure some of you here have prostate problem. That's why you come to this meeting, and I believe this information can help much. Yeah, so. If you want the video, just WhatsApp me, I will send it to you. I'll unmute everybody, so if you want to ask me, so you don't have to. Anyone else like to ask a question? Eddie, would you put up your phone number, WhatsApp number detail, you know, so that if people want to purchase from you, you can just update them? But for those of you who may have a prostate problem, you want to talk to me privately, you can WhatsApp me. Yeah, I'm more than happy to discuss with you.
Just now the Indian guy who talk on the window on the YouTube.
Yeah.
He said that take vitamin D and zinc.
Yeah.
But your slide, you put the B12. Why the difference, huh? The different vitamin.
We suggested D3. There are some doctors suggest certain vitamins. There are some who suggest otherwise other kind of vitamins. So you can do your research yourself. I'm just putting out those people who knows what they're talking about. Yeah, basically. But very importantly, for those with prostate problem, Paneto is the one that is very helpful because it is proven. Yeah, and then lycopene, that is, you can get it from carrot and also from tomatoes. That is the common thing people take. For example, if you buy lycopene supplements, it's actually derived from these two major vegetable. Yeah.
So we are merely offering an alternative for people to find an answer to the problem. That's all. Not so much to make money from you all. Okay, right, Reggie?
Now the main purpose of this Health is Wealth channel that I use to dispense out information on certain topics regarding our health. Obviously today is about our the men's men's prostate. So some of us may not know what to do with it, or some of us unknowingly have the problem without realizing it. So when you come to this meeting, when I talk about running to the toilet a lot and then unable to control your urine, or you urinate and then you find that you still are having urine inside you have that kind of feeling, or there may be a burning sensation when you urinate. All these are symptoms of prostate problem, of which you have to also identify whether your PSA have increased a lot, PSH increased a lot through a PSA test. And then with the test, if it is above a lot, then the doctor might ask you to do an MRI scan. And with the MRI scan, it will let you know whether it's cancerous or not. Once it's cancerous, the doctor will take a biopsy, from your prostate to go and test it, see whether it is cancer or whether it's malignant or non-malignant, whether it is aggressive, non-aggressive, so they can tell you the information. Then only you can take the next step. Do not wait until it is too late, stage 4, don't wait until it's too late. So it's especially men our age, you must at least do a one test to really find out. So I would suggest all of you to do a test. I think the Path Lab will be very happy that I suggested this to you, because basically they will get business, but it's very important to do a test and find out at this age. And if it is cancerous, then you can correct it faster. That's it, that's why I do this meeting. But most important meeting that I like to do is always heart and stroke, because heart and stroke easily preventable, and to certain extent certain form of cancers are easily preventable if you know what to do. So these are my most popular topic as far as health is concerned, because this is the number 1 and number 2 killer. Some of this information that I have.